Good afternoon and welcome to this studio session on the topic Toward a Healthy Global South, Strengthening Health Systems Through Technology. Our discussion today is anchored on the current reality where global health financing is declining, while countries across Africa and South Asia continue to face increasingly complex health emergencies. Now, in this context, technology has become or must become a core part of how primary health care can be delivered in low infrastructure settings. To unpack our discussion today, I'm joined by two speakers who I'll introduce now. We have Sonam Yangchen, who is a health policy and systems researcher at the Institute of Health Partners Bhutan. And then we are also joined by Rishan Sethi, who is a senior research specialist, digital health and AI at Ashoka University and ORF US India AI fellow. So to kick off our discussion, I'll start with you, Sonam. And my question to you is, in low infrastructure settings, what specific technologies have shown the greatest capacity or promise for strengthening healthcare in ways that are scalable and affordable?
Okay, thank you. Thank you for your question. I'll just highlight three equity-driven technology use cases that aligns with Bhutan's national priorities. The first one is digital health, including use of AI for healthcare access. In Bhutan, we face severe human resource workforce shortages, particularly in remote and far-flung areas where access to primary healthcare as well as specialist healthcare services is limited. So in that one, so what we are looking at is technology-driven or AI-powered clinical decision support tools and diagnostic imaging solutions, which plays a critical role in improving access and quality of healthcare. When we say digital health, the end goal is to improve the health. It's not just digitization and improving rapid diagnosis, but improving the health outcome of health of the people at primary healthcare level. And this is also in line with Bhutan's draft national AI strategy, which is currently being developed. And in that one also, they have mentioned the importance of health. And the third one is we are looking at the second one. Is looking at supply chain optimization for Bhutan's vaccine information system, supplying the vaccines and medicines at the far-flung areas. And the other one is health promotion and non-communicable disease prevention through using technology. We also have Bhutan also worked together with global partners like the WHO and other UN partners, and we also have follow global strategy on digital health, UN cooperation, digital roadmap, and principles of digital development. Yeah, thank you.
Thanks, Sonam. Talking about innovation, I come to you, Resham. So digital platforms are expanding rapidly across the global south. And so in your view, what innovations in telehealth, diagnostics, or data systems do you see as the most capable of closing the persistent access gaps that we have seen?
Thank you, Jacqueline. So I'm going to focus predominantly on the global south and, of course, India and Africa predominantly in terms of how do we strengthen the technological relations through South-South collaborations, right?
Yeah.
So just taking a step back from the technology lens, I think there are very few core principles we need to first focus on to strengthen primary healthcare and also digital health data platforms and cooperations. The core principles, in my opinion, is first to have different solutions to be co-anchored and embedded within communities itself. So they need to be co-created, they need to be co-designed. The second principle is we need to have the solutions co-created with communities and all the different stakeholders that are going to be impacted and affected through these digital platforms or AI-enabled solutions. The third is an importance of having a bottoms-up approach and not a top-down model. So it's not that a few high-income people sitting in glass doors deciding what needs to happen in low and middle-income countries and what needs to happen in India or in African countries. It is about the leadership within these two countries across LMICs deciding what's best for them and what is more need-based and having a bottoms-up approach for those development of programs and for solutions. And finally, a core principles which I feel is very important is to have contextualization and localizations of digital health and AI solutions. And by that, what I mean is not having a one-size-fits-all solution. So you take a solution from a high-income country and then you deploy it in India or you deploy it in Africa and expect it to excel. That's not going to happen, because the solution needs to be created for our demographics. It needs to be contextualized as per our population needs. It has to address the challenges that exist in low-resource settings for our countries. So these core principles are very important. So when we're looking at technology and solutions, we're looking at data platforms or digital health programs or AI enabled, I think there are one core aspect which I feel is very important is having AI enabled point of care diagnostics, because there are a lot of diseases that are preventable, but there are so many deaths that happen because of preventable diseases. And it is only because our last mile communities that are underserved and underrepresented do not have access to solutions or to public health services that can save their lives at an early stage. So when we're looking at AI-enabled point of care diagnostics, it simply means that we are trying to have a population level scalability where early detection of fetal mortalities, maternal mortalities, can be prevented, or diseases within the realm of non-communicable diseases can be detected at a very early stage and prevented. So we're saving lives, we're improving outcomes, and this can be done through technologies such as artificial intelligence. Thank you.
Absolutely. Thank you for that. I'll come back to you and prod a little in terms of integrating the principles you've spoken about into the technology. But first, I'd like to go back to Sonam. So from a systems perspective, you've spoken about the experiences of Bhutan in great detail, but more broadly, how can governments integrate these technological tools without overwhelming the already almost very limited state capacity in most countries in the global south? Yes.
Okay, thank you. Just to build on what Resham said and coming back to your question,
Yes.
I feel like for country like Bhutan, we really, in terms of integrating and embedding AI and digital technology in the healthcare, we really should focus on building trust and transparency. And because AI and DPI must be explained to all levels of healthcare in the health system, like for professionals, for medicals, for researchers, for policymakers. So it should be demystified, because for different players in the health system, they understand it differently. So we have to ensure that it's demystified. And also, when we say building trust, also means that AI systems are explained to all users in simple terms, and it should be auditable and developed with public interest in mind, and that for the health sector, it's delivering quality and safe health services. So public interest should be at the core, and it's not just for rapid or fast diagnosis of the diseases. And also, I feel the other principle or other thing is we need really targeted capacity building programs for health planners, policymakers, and digital health systems. As well as Resham also mentioned about citizen engagement, where communities can also contribute to setting ethical principles and safeguards for AI in healthcare, and co-creations, as mentioned by her, for solutions. Of course, we have platforms in Bhutan for citizen engagement, and we also need strong data governance mechanism as safeguards for AI in healthcare. And especially for my country, right now, we really do not have a legal framework for health data governance that ensures privacy, and we really have to establish that and have informed consent and role-based access to health information, because right now we do have electronic patient information system that is accessible by all healthcare workers. So we need to have that role-based access to health information, not the blanket approval. And anonymization must be made mandatory for all secondary use. Yeah, thank you.
Just to prod a little further on that, what is an example of one thing you think governments are getting right so far, just based on what you've said? Because there's a lot of gaps, there's a lot they can do. Is there anything that you think they're getting right on?
The one thing which the governments are getting right is aligning with the global initiatives for digital health, having a digital blueprint or a framework for governance, like which sectors, so governance framework should be developed. So of course, when you talk at the global level, I just saw data from the WHO, only 15% of the countries have AI legally binding that governance mechanism, but like we should really advocate for having a governance framework. Yeah.
Thanks a lot, Sonam. So back to you, Risham. So you talked about principles in great detail in your first submission. So my second question to you then is, AI is obviously becoming more present in a lot of what we do, health decision making notwithstanding. So in contexts that where we have limited state capacity, what safeguards or governance principles do you think would be essential to ensure that the tools that are deployed support equity and inclusion, and they do not exacerbate or deepen disparities? So bringing in those principles specifically to AI application.
That's a very good question. Thank you, Jacqueline. I think all of these things should be embedded within how national digital health strategies for AI or for other programs are formalized in the country. In coming from a research background, I think when we are designing government programs or strategies or policies, all of these aspects and the principles that I mentioned should be incorporated as a cross-cutting principle, right? When we're talking about co-creation with communities, when we're talking about, like she said, having trust within communities. So these principles, including equity, should be a cross-cutting principle. Now, when we're talking about designing certain programs or designing digital health blueprints, strategies, or let's say AI strategies for India, for Africa, or for different global South countries, I think we need to follow a very scientific, evidence-based, robust methodology to do that. To have these programs principled and to have a participatory approach to it. So we can first getting into doing a desk review, having global best practices, aligning with global initiatives like she mentioned. Global initiatives could be GUIDE, it could be the Global Initiative on AI for Health. And in addition to that, also understand what your national context is like. In addition to the global initiatives, right? Because these global platforms is something that is, it's a broad umbrella. The actual thing has to be that it should be contextualized to regions. It has to be contextualized to different national contexts. So that's where we do a robust understanding of our own country's needs and challenges and the current state of art where we are at. And second would be having extensive multi-stakeholder conversion workshops that incorporates stakeholder inputs. And by stakeholder inputs, I mean private sector, startup ecosystem, policymakers, government, different decision makers, academia, communities, frontline workers, community health workers, people working at the grassroots, incorporate their feedback as to the programs and the policies that are being designed. Does it even reach them? Does it even address the challenges that they're experiencing, right? Because some government officials could be sitting very far away from what actually happens on the grassroots. So how do we hear people's voices and the challenges that they're actually facing? And this usually happens when we are having conversion workshops, right? And then finally have a public consultation workshop where we are incorporating citizens' challenges, we're incorporating citizens' perspective in designing that program. So it's not only, this approach is not only anchored in communities, but it is also very participatory. It's bottoms up. It challenges the entire top-down model. And it is something that is localized, contextualized, and regional focused. So answering to your question, this I think should be incorporated. It's done in many countries. India is one of them where we're incorporating it. African countries have been incorporating this approach. And it is only so that we understand the context of our own countries and develop and build on that leadership that we have. Thank you.
Thanks, Risham. So your comments very briefly before I wrap this up. Do you think the Global South has the capacity to integrate technology and AI, more specifically in designing the health solutions as it is? Do we have that capacity?
I think the question should not be whether we have the capacity. I think that's unsaid. I think the question is the global not ready to let us lead? Should be the question. We've always had the capacity. We have the resources. The problem is the institutions are built in such a way that we are not allowed or we are not made to lead. And that's the problem, right? So answering to your question, I'll reverse it.
Yeah.
Yes, we have the capacity. We've always had the capacity. We are now advocating and want to be part of decision-making tables, decision-making processes.
Yes.
And I think in terms of strengthening the South-South collaborations, the South-South cooperation, what we need is a lot of joint work where the leadership is coming together. We can have strong innovation hubs, joint research, having a deployment approaches where a solutions that could be built in Cape Town, can that be used, contextualized, and deployed in India? Yes, and vice versa, right? So we're looking at South-South scaling. We're looking at South-South deployment. Yes. We want to build and have a strong technology exchange, a strong talent exchange. And this is something that everybody should realize and accept it, because we will be doing that moving forward.
Great. Thank you so much. So thanks a lot to both our speakers for the insightful discussions and reflections. So the main takeaway that I get from this is that the path for the stronger health systems is obviously or lies in practical technological solutions, smart policy design that incorporates the principles that they've spoken about very articulately, and cooperation amongst communities. So with that, we wrap up this session, and thanks everyone.
Thank you so much.